Hi Priya, my name is Sarah Jensen. I'm one of the doctors here at First Steps Pregnancy Support. Thanks for coming in today.
Thank you for seeing me, Dr. Jensen. I'm really scared about this unplanned pregnancy and could use your guidance on what to do next.
Absolutely. Can you tell me how far along you are, if you know?
I'm not exactly sure. My last period was on the 10th of April and my cycle is typically 28 days.
Okay, so let me just work that out. So 10th of April, 28 days, that would make you about 7 weeks today and a due date of the 15th of January.
Thank you for figuring that out. It's helpful to know where I stand.
Can you tell me how you're feeling about all of this?
I'm feeling a bit overwhelmed. I want to keep the baby, but I'm not sure if I'm ready emotionally or financially. My boyfriend isn't supportive and it worries me.
Okay. What is your situation at the moment? Are you working or studying?
I'm currently working part time, but I'm worried about managing expenses and finding support if I continue with the pregnancy.
Absolutely. So, we provide a lot of support services here. So, for women like yourself who are feeling like they're not sure if they can continue their pregnancy because of a lack of support, we can offer things like medical care that you don't need to pay for. We have a social worker here that you can see to help make sure that you've got all the things that you need. We've got a midwife that you can see here also for appointments. And we can also organise any baby items that you need from a local service called Roundabout. We've got birth classes, we've got parenting classes, we've even got a freezer full of meals.
That sounds really
And
reassuring. I'm grateful to know there are resources to help me through this. How do I start accessing these services?
well, you're here today, so that's really the beginning of being able to access those services.
That sounds helpful. Is there someone I can talk to about emotional support and how to handle my relationship situation?
Yeah, absolutely. So, seeing me, we can cover a lot of the medical side of things and look a bit at your mental health as well. And our social worker, Laura, can help address some of those other things.
Great to know. I'm concerned about my boyfriend and whether he'll stick around. It's been tense lately, and he's not really supportive.
Yeah, no worries. That's really understandable concern. Are you living together?
No, we don't live together. I live with my parents, which helps, but I'm just worried about how things might go with him.
Of course. Is he working at the moment or studying?
He's working, but his job keeps him somewhat busy, which also means he's often stressed. I'm just worried about the growing distance between us.
Yeah. Before you found out you were pregnant, how was your relationship with him?
It was okay for the most part, but I noticed he started becoming a bit more aggressive lately. It's been concerning.
Mm. And when you told him that you were pregnant, how did he respond?
He told me to just get rid of it, which hurt me a lot
Mm.
and added to my worries about our future together.
Of course. Do you have anybody in your family or your friends that you feel safe with and supported by who you could talk to?
Yes, I have a very supportive sister. I feel like I can tell her anything and she will listen and understand.
Mm. Mm. Have you told her that you're pregnant?
Not yet. I haven't been sure how to bring it up, but I know she'll be supportive when I do.
Yeah, maybe just organise to get together with her one on one and just tell her, and that will be the beginning of it.
That makes sense. I'll try to plan a time to talk with her soon. Thank you for your support and advice.
Are you taking any pregnancy vitamins at all?
No, I haven't started taking any yet. Do you have recommendations for what I should take?
Yeah, I can actually get some out of our cupboard for you today. Some folate tablets. So we have the Blackmore's pregnancy vitamin. If you take 2 a day of those, that will give you the right amount of everything that you need at the moment for the pregnancy.
Great. I'll make sure to take them as directed. Thank you for providing those for me.
No worries. I'll also give you a referral form for some blood tests and for an ultrasound. We have an ultrasound here, so we can have a look today, but then you'll also need a formal ultrasound as well in a few weeks.
Thank you. That sounds good. I'm glad we're taking these steps to monitor the pregnancy and ensure everything is okay.
Yeah, I think a good next step would be to link you in with our social worker, and she can talk to you about all the different ways that you need support and the practical things that you will need as well later on.
That sounds really helpful. I appreciate it. How can I arrange a meeting with the social worker?
I can book you in for that now. We can have a look when she's available and what suits you. And then once you've had your blood tests done, then I will get you to come back and see me and we can continue our conversation from here.
That sounds perfect. Thank you for all your support and guidance today. I feel much more at ease knowing there's a plan in place.
You're most welcome.